Hi, this is Ellen for Ellen Knows. I get a lot of questions on hearing aids as far as what kind of hearing aid is best for my hearing loss. And there is no real simple answer. There's a couple factors regarding hearing aids, so you really do have to consider a couple things first, and then you can figure out your options. One of the first things you need to know is how much hearing loss I have and where the hearing loss is. For example, if you're having the most common hearing loss that I see is usually a sloping loss, where you have relatively normal lows and you have more loss in the high frequency. It's high frequency hearing loss. So if it's sensory neural, which means the hearing loss is in the nerve and there's nothing going on in the middle ear, a really good, probably the best hearing aid for you would be a receiver in the canal. Receiver in the canals come in a lot of different flavors and styles. This happens to be a Siemens hearing aid. These are mine. And they come in a whole bunch of wonderful colors, which are here. See all the pretty colors. And the receiver in the canal basically means that you have your unit, which is back here, and then you have your receiver. The benefit of the receiver in the canal is twofold. First of all, I can take this receiver off. Okay, and God forbid, no one wishes this on anyone, your hearing gets worse. I can remove this receiver and put on a more powerful receiver that fast, and then it just requires a little bit of reprogramming. Also, if you notice the bud, there's all different kinds of buds. There's ones that are called occluded without holes, and then there's open, which with holes. There's doubles. There's all kinds of ways to protect your ear, or your to prevent feedback, because that's basically what these are for. It's to hold it in your ear and to control feedback. And also allows for a lot of natural sound in and out of the ear, so it can vent out those low frequencies so you don't feel something called the occlusion effect, which is like stuffiness or real boominess, and that's very unpleasant. I wear hearing aids in both ears. I have for many years, and it's very unpleasant, that stuffy feeling. No one wants to feel like you have bananas in your ears. So these are really great for sensory neural high frequency hearing loss, okay, and they're very comfortable. Now, if for some reason you just cannot tolerate a hearing aid behind the ear for whatever reason, I do have a few patients with CICs. This is this right here. My hearing aid is very tiny. Ooh, it got quiet in here. And I wear both kinds because, I dispense them, so I have access to them. I like them both. There's no one I like better than the other. I like them both. They both have advantages and disadvantages. These, you don't even see at all. See, I'll bring my ear close to the camera. See? Don't see it. People are shocked when they find out that I wear hearing aids. So, and that's always nice, because then if you're really worried about image or people seeing them, they don't see these at all. The only thing is it took me a long time to get used to them. So it probably took me over 6 months to get used to having something in my ear. So they're not as comfortable as the receiver in the canal, but they don't show, and the sound, I happen to like these. These are the Microtech hearing aid called the IIC. It's a very deep fitting hearing aid. You need to have the right canal shape and canal size, and so there's a few factors to whether or not you can wear an IIC. If you can't, then you go to the next phase, which is a little further outside the canal, which is a CIC. No problem. That's called a completely in the canal. That's a in the ear aid. And as long as the vent is large enough, you shouldn't feel that occlusion effect. So it just requires, fair warning, it requires additional fittings. So just keep that in mind. Please be patient with your dispenser. And it does require many fittings, extra fittings for CICs. That's why they don't like fitting them so much. Now, if you have a flat loss, okay, it's where your audiogram goes flat. The receiver in the canal also works, but also, some good bets are in the canal hearing aids. They come in a lot of sizes. This one here is called a half shell. It's a little bit bigger. It fills about half the ear, okay? And then again, the CIC is tiny like mine. And then they have a full shell where it fills the whole ear area here. And that has more to do with preference and dexterity. If you have shaky hands, or if you have a hard time pinching your fingers, or if you don't have the fine motor skills, don't go tiny, tiny, tiny. It's just, it'll do nothing but frustrate you. So try to go, just consider going a little bigger, or go with a receiver in the canal. Now, if you have more extensive losses, you're going to have to go with a behind the ear aid, because some hearing aids do provide additional power that are very small. There is one I know from Siemens that goes all the way to 70 gain. It's a CIC, but you have to have the ear canal to support the size of that receiver, because the receiver does have a physical size. The next hearing aid would be a behind the ear. And it has a mold like that. And the molds come in all different sizes, so you can have smaller molds, bigger molds, so it varies. I mean, I have like a little tiny mold here, so there it is. See, and that looks big, but it's really not. It hardly shows. So those are just some of the styles and some of the things that are available to you. My next video will talk about hearing aid pricing, and kind of give you a heads up on how hearing aids are priced. This is Ellen for Ellen Knows, and you have a good day.